Thank you, Dr. Lang. I'd now like to call up Lucy Rios, who's the interim director at the Rhode Island Coalition Against Domestic Violence. And the coalition has been a strong advocate over the years for improvements in the Rhode Island Works program, both in terms of the structure of the program, the benefit amount, and then provides direct support to families who may come onto the cash assistance program because of domestic violence, providing counseling and support services to the women who are fleeing domestic violence. So Lucy, come on up.
Thank you, Linda. And good afternoon, everyone. I am Lucy Rios, the interim executive director at the Rhode Island Coalition Against Domestic Violence, and on behalf of our 4 full member agencies, the Blackstone Valley Advocacy Center, the Buffum Chace Center, the Domestic Violence Resource Center, and the Women's Resource Center, and our Task Force of Survivors, SOAR, Sisters Overcoming Abusive Relationships. I am here to voice our strong support for raising the Rhode Island Works cash benefit amount and for making needed improvements to the program to uplift Rhode Islanders out of deep poverty. These improvements include extending the lifetime limit to 60 months, as you've heard, and allowing parents to attend 2 years at CCRI to receive credentials needed for a job that pays a family-sustaining wage. The Rhode Island Works cash benefit amount is a lifeline many Rhode Island families, including survivors of domestic violence, rely on. The need for support from the Rhode Island Works program has not changed. In fact, it's only intensified during the pandemic. Member agencies serving victims across the state have seen demands skyrocket the past 2 years, with over 17,758 individual victims of abuse served and 87,543 individual services provided by advocates. In 2020 and 2021, we saw spikes in calls to our helplines and hotlines for a total of 31,529 calls. This represents more than mere numbers. This represents the many people experiencing domestic violence right here in our state who need our support. And we know that many victims are not able to come forward and seek support. Financial insecurity continues to be a main barrier for survivors on their journey to safety, with 99% of domestic violence cases including financial abuse. Survivors know all too well how the cost of living continues to rise, with inflation making matters worse. Many times, a main factor that keeps victims trapped in an abusive situation is a lack of funds needed to access basic needs: safe and affordable housing, to live free from abuse, to pay the bills for health care, and for food for themselves and their children. The assistance we provide Rhode Islanders must reflect those increases in living expenses during the pandemic and beyond. Some members of SOAR have relied on this program as a lifeline for themselves and for their children after escaping abuse. And they have helped to advocate for improvements to the Rhode Island Works program right here at the State House, because they understand how such a program can help keep survivors safe and help them heal and thrive after experiencing violence at home. One SOAR member shared, and I quote, "I currently am a recipient of Rhode Island Works, and while it has helped me stay afloat financially, I find myself still struggling to meet some of the basic needs for my family. This includes housing, clothing, and even food. With the current amount, though the increase helped last year, I am not able to afford to buy enough food for me and my family. There have been times when I found myself struggling to provide food, and on those days, I wouldn't eat to ensure my daughters had enough. I also find myself looking for loans when my kids needed new clothes because I couldn't afford them otherwise." As a safety net program, Rhode Island Works should be giving families a fighting chance to be financially safe and secure, and not keeping them in a state of crisis. As we emerge from the global pandemic, we must ensure victims of abuse and their families are not left behind. Survivors face both short-term and long-term impacts from 2 public health crises: domestic violence and COVID-19. The benefit increase last year helped thousands of children and families who were enrolled in the Rhode Island Works program, but they're still living in deep poverty. By raising the monthly benefit to 50% of the federal poverty level, we can deepen our commitment to supporting families. Raising the Rhode Island Works benefit and making these other needed improvements to the program is more than a financial issue. It is an equity issue and an anti-oppression issue. The burden of domestic violence does not affect us all equally. The lifetime prevalence of experiencing sexual abuse, physical violence, or stalking by an intimate partner is 48% among Indigenous women, 45% among Black women, and 57% among multiracial women living in the United States. These same communities are also disproportionately affected by poverty, oppression, and a lack of access to resources. We can build a better and safer Rhode Island for everyone, including victims of domestic violence, and we must, because it is just. To end domestic violence in Rhode Island, we must interrupt systems that prevent us all from surviving and thriving, and step up to care for our communities. By making these improvements to the Rhode Island Works program, we can strengthen support for all Rhode Islanders and ensure that those that are most impacted by violence have the means to begin to build their lives free from abuse and thrive. Thank you.